Welcome to Fempower Health. This is Georgie. Here we tackle the tough and often overlooked issues in women's health. And today I'd like to talk a bit more about chronic pelvic pain. In case you had missed it, Fempower Health has covered all sorts of women's health topics over the course of the many seasons that we've been in existence. And after looking at all the data, what's been clear is you're really coming to Fempower Health for the complex healthcare issues that women are facing. And a lot of those are currently related to chronic pelvic pain, as well as perimenopause and menopause. And I've created now channels where we have the main podcast feed, which many of you have been following and subscribing to. So thank you so much for that. But to help you have a more customized experience, there is now a chronic pelvic pain hub as well as a perimenopause and menopause hub. So please do follow those where you listen to your podcast. So today I wanted to dive into chronic pelvic pain and why it is so important for Fempower Health to cover this. Because at the end of the day, Fempower Health was built to help you advocate for your health. So in case you didn't know, I have a healthcare background on the business side, and I have been a consultant, and my specialty and superpower is all around the processes and systems that are in place and the stakeholders that are involved to make things happen in healthcare. And most of that has been with biopharma companies up until now. And because of these past many years of running Fempower Health, I've spoken to well over 100 clinicians. I've spoken to femtech founders, insurance companies, otherwise known as payers, etc. And the one thing that is 100% clear to me is because of this chaotic healthcare system, the lack of research and money being funded for women's health, which, by the way, this year it's changing significantly and has been over the past recent years. We're kind of stuck in the middle of navigating the healthcare system. And not everyone has the same fortune that I do to have a healthcare background, so I understand how to navigate it. And so my mission has been to use both my expertise in navigating the healthcare system, plus the expertise of each of the clinicians that I've been speaking with to help you all have a better picture of what might be going on with you so that you can advocate within this crazy system. And of course, my hope and my wish is that over the coming years, there will be more research and data and better diagnostic tools and better treatments for the various conditions that women face. So for now, it's all about empowering you to advocate. So why chronic pelvic pain? Chronic pelvic pain is complex and often misunderstood because it's not just one thing, and it tends to be a collection of symptoms that can stem from various conditions like endometriosis, interstitial cystitis, pelvic floor dysfunction. But here's the thing, it's also not always about pain. And trust me, I did think, wow, should I have called this the Chronic Pelvic Pain Hub? Because it's really more about pelvic health, but then people think that it's all about Kegels. So for now, for lack of a better word, it's the Chronic Pelvic Pain Hub. But nonetheless, for many, the conditions, because it's not always about pain, it can be debilitating fatigue, digestive issues, emotional toll that comes with all of this. It can be pressure in your pelvic area. So chronic pelvic pain can affect every aspect of your life, from your physical health to your mental well-being. And as I'd mentioned, I've had the privilege of speaking with incredible experts on this subject. So, for example, I've spoken with Dr. Allison Sherkande, who's been a guest many, many times, and she's spoken about the critical need for early diagnosis in endometriosis and how a comprehensive treatment plan can save lives. I did a 4-part series speaking of endometriosis, where I interviewed someone who is trying to build a femtech company. I shouldn't say try. She is building a femtech company around helping with earlier diagnosis, and she was a patient herself that was able to advocate and finally get the proper diagnosis. And so I interviewed her. I also interviewed Katie Boyce, who is a staunch patient advocate for those who are struggling with endometriosis. I also interviewed Dr. Shanti Moling, who shares all the details that you need about surgery as it relates to endometriosis. And then I also interviewed Caitlin Tivy, who talks about pelvic PT and its role in endometriosis, just to give you an example. And then Dr. Peter Wright, she's one of the most popular episodes I've ever done. She emphasizes the importance of looking at the whole woman, not just her symptoms, and how holistic care can improve overall quality of life. I've even interviewed Tanika Gray Valbrin, and she is a patient advocate for uterine fibroids. I've also interviewed a ton of pelvic floor PTs, and they've talked about everything from pelvic organ prolapse and how through all of our phases of life, our hormones change. And because of that, it can impact our pelvic health. And so anything that you want to know about pelvic health, you can go to the Fempower Health website, and there's a whole section on all of those episodes. But again, you can also follow the Chronic Pelvic Pain Hub where you listen to podcasts. And outside of the diagnosis is also the treatment. Sometimes the treatments are really just about pain management rather than treating the underlying cause, because we really do need to better understand so many of these conditions that women face. So also the healthcare system, it can be overwhelming, especially when dealing with something as complex as chronic pelvic pain. There's gaps in specialist knowledge, and it's easy to feel lost in this sea of referrals and treatments. And this, again, is why it's so important to learn how to advocate for yourself. And no one knows your body better than you. And understanding how to navigate the system is key to getting the care you deserve. So as an example, one of the things I've learned in all these interviews that I've done is there are a lot of subspecialists, but even within these clinicians in the healthcare system, there are different degrees of training and quality of care and so many other factors. So one concrete example is in the world of endometriosis. So one of the keys is getting an early diagnosis. And if you do need laparoscopic surgery, one of the frustrations has been finding the right clinician. Because if you think about an OBGYN, they're trained in so many things. They're almost like the primary care practitioner equivalent for women's health. And just like when we go to our primary care doctor, they don't treat heart disease. We go to a cardiologist. And you kind of have to think that way almost when it comes to the OBGYNs. And so if they're doing general surgery, and because of the complexity of endometriosis, if they haven't done a lot of those and have not done a lot of complex cases, that really puts you in a place where you may not get optimal care. And again, as Dr. Peter Wright said, it's more than just about surgery. But again, I'm speaking very specifically to if you do need the surgery, you have to make sure it's the right expert. And also that you have dual decision making. And even another interesting example is when it comes to hysterectomy. So what I was surprised by, and I did 2 episodes, one with someone who does surgery on hysterectomy so that you know how to advocate in preparation for the hysterectomy and then after, because depending on if your ovaries are removed, it impacts hormone levels, which could impact whether or not you need hormone therapy. But then also how pelvic PT plays a huge role. And we may not always think about that, but really anything that is being touched, so to speak, between your belly button and your upper thigh, that is going to impact your pelvic floor. We also talk about how the structure of your posture and other factors in your body, not just in that belly button to upper thigh region, can impact the health of your pelvic floor. So I'm not at all trying to overwhelm you. I hope that I'm more just giving you examples of why it's so important to advocate for yourself and why it's kind of hard to navigate this system. And so what I really do is create episodes that are as specific as possible so that you can kind of sort through what's going on with you to figure out which episode to listen to so that you can get the most support. And one of the things I'm starting to do is shift more into, as I can, of course, because it depends on the topic, more symptoms. So one of the interviews that I'm working on doing now is, if your bladder area is bothering you, what could that mean? Because to you, that's the symptom. You may not Google and find on Fempower Health interstitial cystitis, because unless you've heard the term, you wouldn't look for it. But if you're having one of the symptoms related to that, you're going to look for that and then realize that it could be interstitial cystitis as an example. So that's one of the things that I'll be working hard to do, is really look at it more from your own perspective, and the symptoms that you may be experiencing. Okay, so how do you advocate for yourself? Again, it's crucial to be informed. We need to know the right questions to ask your doctor. For example, you could say, could this pain be related to my menstrual cycle? Or what are the possible underlying causes of my symptoms? We should ask that, because if we don't, doctor appointments are shorter, and doctors are human, and maybe they're on autopilot that day, or maybe they're not a subspecialist in something and are so used to, if I see X in a patient, I do Y. And so it's really important to kind of create that pause and ask these questions. So make sure you list them out before you go to your doctor, so you do not forget when you're in that appointment. The next thing is to really track your symptoms. And it may be tedious, but keeping a log of these symptoms, when they occur, their severity, any potential triggers, can provide invaluable information for your doctor. Like one example, so I do belly massages. I have endometriosis, and I also will sometimes have constipation. And for me, like if I eat well, I'm fine. But if I don't, oh my goodness, it's not so fun. So the belly massages are great. And I remember when I was doing them more frequently, I had this pain near where my ovary is on the right side. And I will admit, I dismissed it. I didn't think much of it. I went to my OBGYN, and it turned out to be a cyst. And we watched it, and on its own, it ended up going away, but it was still valuable information because we were able to check it out. So try not to dismiss them, and don't be hard on yourself if you do. I remember recently a clinician was posting how she dismissed her own symptoms, and she ended up having to get surgery and was kind of out for a little while because of this. And so it can happen to all of us. I have friends who are clinicians, and they've had family members where they're like, no, it's fine. And then it turned out to be something. So we're all human. Forgive yourself, but just really do try to monitor and advocate about that. And then really prepare for your appointments. Go in with a clear agenda, and don't be afraid to ask for what you need, whether it's a referral to a specialist or a specific diagnostic test. And you'll find in the Fempower Health podcast episodes, what I really do is work with the clinicians to understand what the condition might be or the symptoms, and then how is it that you navigate talking to your doctor or the type of subspecialist that you may want to see. And, we also acknowledge some of the challenges in the healthcare system. So we really do kind of walk through all of that in these episodes. And what's so cool is I know it works, because I've had people reach out to me and they're like, oh, I just heard about the Fempower Health podcast, and I binged on your episodes, and I've had all these things going on with me for 20 years. And now that I've listened to this, I've put the pieces together, and now I know exactly what to share with my doctor to get the care I need. And when I heard that, I was like, oh my goodness, that's literally exactly why I do this podcast. So to help you on this journey, there are resources on the website, including previous episodes where we've discussed these issues in detail. So remember, you're not alone in this. I won't lie. So Fempower Health currently is self-funded. It is something that I've been doing in my free time on top of being a single mom and having a full-time job. And so I have all sorts of things that I really want to be creating for you guys, but it's just going to be a matter of time. And so just know that on my side, I'm doing the best I can, but I also have to advocate for myself and my mental health. And so I do need to sleep and take care of my son. But just know that on the website, I do have things organized in the best way that I can for now to help you on this journey. So in closing, pelvic pain, it is a journey to navigate. And while it can be challenging, you do have the power to advocate for yourself and seek the care you deserve. So I really appreciate you joining me today. And if you found this helpful, please share it with others who might benefit. And I would, of course, greatly appreciate you writing a review where you listen to this podcast, because it really helps others become more aware of this valuable information. And as always, stay tuned for more insightful conversations on Fempower Health. And if you have any specific questions or suggestions, please feel free to reach out. I'm always open to hearing that. This podcast really is for you. And it's been my privilege to take my healthcare expertise and my love for interviewing clinicians and bring that to you to help you. So thank you so much. And that wraps up another empowering session here at the Fempower Health podcast. Before you dash off, I've got 2 quick, exciting invitations for you. First, if you're looking for content related to chronic pelvic pain and or perimenopause and menopause, did you know you can subscribe to just those feeds? Find the podcast channels on our website or where you listen to podcasts. Second, join our vibrant community by subscribing to our newsletter. It's not just any newsletter, it's your frontline update on groundbreaking women's health research, the latest health-enhancing products, and unique discoveries you won't want to miss. All of this delivered straight to your inbox, cutting through the noise of social media algorithms. Better yet, you can pick the perimenopause and menopause edition or the chronic pelvic pain edition, or both. Love today's insights? Show your support by rating and reviewing our podcast. Your feedback is more than just a pat on our backs. It lights the way for others seeking guidance and community in their health journey, amplifying the voices that need to be heard. And for a deeper dive into today's topics, check out the show notes and explore our website at fempower-health.com. Our site is a treasure trove of knowledge, neatly categorized by topics of interest and life stages, ensuring you find exactly what you need to empower your health journey. And your voice matters to us deeply. Whether you have a question, a story to share, or feedback on our episodes, reach out directly at info@fempower-health.com. Drop us a message on social media or hit reply to any newsletter. Your insights inspire our conversations. And don't forget to follow us on social media for more updates, tips, and community interactions. We're on Instagram, TikTok, and LinkedIn at Fempower Health. And yes, we have specific socials for chronic pelvic pain and perimenopause and menopause too. And a quick note, the knowledge we share here is to embolden you in discussions with your healthcare provider. It's not medical advice. Always consult with your doctor for health decisions. And remember, the diverse perspectives of our guests reflect their individual journeys, not an endorsement. Here's to empowering your health journey, one episode at a time. See you on the next Fempower Health podcast episode.